Well, hello everyone. My name is Professor Christine McCartney and I am the Director of Australia's National Centre for Immunisation Research and Surveillance. So I'd like to thank you all very much for joining us this afternoon for our special webinar on supporting COVID-19 vaccine access in the Indo-Pacific. I can see that we still have people coming onto the call, and indeed we hope to still have some of our international guests joining us, but we're going to get started. And to do so, I would like to begin by acknowledging that we are hosting this webinar from the lands of the Darug people and as part of the Great Eora Nation that occupies the Sydney area, also known as Sydney, where I am, of course, sitting. So we very much acknowledge Aboriginal and Torres Strait Islander peoples and communities and pay respects to their elders. We acknowledge that Aboriginal and Torres Strait Islander people are the First Nations people of Australia and traditional custodians of the land and water on which we live, work and play, and value their principles of self-determination and empowerment. So, and you can see that, I think, just from the artwork that we were showing, which was commissioned by the National Centre and done for us by Samantha Williams, a proud Wiradjuri woman. So just a few housekeeping tips. First, you can certainly post questions to us in the chat function. And if you like a question, you can also upvote it by clicking on the thumbs icon here. I expect you're all very familiar with that for Zoom now. We're going to keep this webinar fairly informal in the sense of having a fewer number of slides than we've previously had in our webinars. And this is to allow a little bit more free-flowing discussion. So we'll have some comments from each of our speakers, and then we will go into a panel session at the end. And again, you're welcome to have post questions to the panel as well. That'll be moderated from our end. So I just wanted to make a few comments about our position here in Australia. And I think you will know us, no doubt, as the National Centre that has been funded for almost 25 years to work domestically in support of immunisation programs, particularly with the Australian government and state and territory governments, as well as, through other sources of funding. But, in the last 3 to 4 years, NCIRS has certainly also engaged in our region through different sources and different countries, but certainly in respect of the recent times, we have formed a global team here at NCIRS, and as well, we've taken a step along with our many wonderful colleagues from these various institutions to join together in an alliance that we call the Australian Regional Immunisation Alliance. And this is exactly, I guess, as the name implies, it's a number of leading individuals, experts and their institutions with a breadth and depth of experience in immunisation and vaccine preventable disease control. And we are, working in a connected way to offer greater capacity in support of, countries and programs, researchers, governments in our region, knowing how important prevention of disease is. And interestingly, of course, this alliance was formed well before the COVID-19 pandemic, but I think, that incredible impact on our lives has only strengthened our resolve to work together. So we do have the Secretariat and current chair of the ARIA Alliance at NCIRS. We have a wonderful steering committee, and we're very privileged to have received funding for 2 programs of work, actually, and these have both been funded currently with ourselves, NCIRS, University of Sydney and other partners all involved, from funding from the Department of Foreign Affairs and Trade, and that is for both the Regional Immunisation Support and Engagement Program of work and for a new program which you'll hear a little bit more about today, particularly from our guest, Ambassador Stephanie Williams, on the Australian Expert Technical Assistance Program for COVID-19 vaccine introduction. So just moving to the next slide, a little bit less about us. We did want to put a plug for our partners from the Therapeutic Goods Administration, and Michael Wiseman from Therapeutic Goods will be joining us very soon. And if we just move to the next slide, I thought I might, before we introduce our distinguished speakers, thought we might just have a reflection on some of the current epidemic situation with respect to COVID-19. So this is a slide from our colleagues at WHO, and you can see here that indeed many countries in our area are going through additional waves of COVID-19 at the moment. And we all know that this is also related to the emergence of new and highly transmissible variants, including the Delta variant. Sydney is in fact currently experiencing what I think can still be characterised as a small outbreak by international standards of the Delta variant, and we hope it will remain small. But in many countries in our region, that have been so successful in battling the pandemic for so many months, and in fact well over a year, such as our colleagues in Vietnam, Mongolia, for example, and other areas, and indeed, in fact, Fiji, which I don't think we have listed on here, but we send our best wishes to them, because I think they are now really challenged with outbreaks, not to mention some other countries that are continuing to see fairly high or new waves of the disease. Next slide. And here's some data more specifically from the Pacific Island countries. And I think, every one of these countries has also done a remarkable job in many ways in battling the pandemic, either keeping cases to very low numbers or, certainly being able to deal with larger scale community transmission. Next slide. It is important to reflect on the fact that we have now, as a globe, seen, and this is the good news, more than 2.6 billion doses of COVID-19 vaccine delivered. But we do know that delivery and use of vaccines across the globe is still very inequitable. And I think this is a fact that, is reflected on many days in the media. Indeed, 10 of the wealthiest nations in the world probably taking a very large proportion. I think it's at least 80% or more of the doses. And some areas, 5 countries, in fact, or economies or territories that have not yet started vaccination programs. We've seen, of course, the use of the COVAX facility, which I'm sure Stephanie will speak more about in respect to the donations, including by the Australian government to this facility. But it is incredibly important for all of us that we do see COVID-19 vaccines rolled out more equitably across the globe, because high transmission of this virus in any setting is a threat to us all. Particularly, it makes a lot of sense epidemiologically in respect to preventing emergence of variants, and it makes sense to us all economically. So just a little on, again, reflecting on our Pacific neighbours, sharing data that's kindly collated by colleagues in WHO, and I would commend WHO on the many lovely dashboards and ways in which they do share data. We've been privileged to be part of the Western Pacific region immunisation technical advisory group meeting these past 3 days, and it is quite incredible to see the really detailed data that is coming through from all of the countries in the Western Pacific region, as well as in the Southeast Asian region. So you can see many countries here that are have done incredibly well in our region, actually, and have very granular data on those who've received 1 dose and those who are fully vaccinated. And some countries just starting, but some countries have gone a long way already. So I think these it's a wonderful community in the Pacific who I know are sharing stories and experiences, indeed also through colleagues in the DPS office in Suva. Next slide. This is from the dashboard in Ciro, because I didn't want to forget, of course, that we have our colleagues from Timor-Leste on today. And Timor-Leste is, although only an hour's flight north of Darwin in Australia, it is a country that is in the Southeast Asian region of the World Health Organization, along with 10 other countries here, and you can see just a quick snapshot from the dashboard of immunisation coverage in these countries. So with that, I am going to move now, and I'm just looking online. I think we can go to the next slide, Genevieve, and just indicate that we are hoping that Ms. Tikaki and Mr. Tokataki from Kiribati Ministry of Health and Medical Services will be able to join us. I understand that they are having some challenges in connecting, and I'll just pause at this time. And I know Dr. Stephanie Williams from DFAT is in connection with them, and I can understand from our team that Ms. Tikaki and Mr. Tokataki are still attempting to connect. Let's cross our fingers that they can do so shortly. So we'll switch our order then just a little, and we're incredibly lucky to also have on board colleagues joining from Timor-Leste, and indeed the capital of Timor-Leste, Dili. So I'm hoping our own Dr. Sarah Sheridan, of course, has been embedded in the COVID-19 vaccine program in Timor-Leste, and I'm hoping if Sarah can come on camera, she might be able to indicate to us if either Dr. Adeti de Silva Viegas or Mr. Nevio Samento are with us. Ah, there they are. Hello. So it is my great pleasure. I'm absolutely delighted, and I wish I was there in person to do it. But if I could welcome, firstly, Dr. Adeti da Silva Viegas, who is the Director General for Health Services at Timor-Leste Ministry of Health. And in this position, Dr. Da Silva has been absolutely integral in leading and contributing to the COVID-19 public health response in Timor, and also now with a focus in Timor onto the rollout of vaccines, which we're really looking forward to hearing about today.
Thank you.
And can I also welcome, next to her is Mr. Nevio Samento, who is a senior scientist and microbiologist at the National Health Laboratory Timor-Leste and member of the National Immunisation Technical Advisory Group in Timor-Leste. And Mr. Samento, of course, was also engaged with the work of the Ministry of Health on the protection of Timorese people from a range of vaccine preventable diseases, but I know has been very involved as well in the COVID-19 response. So it is, you know, with great warmth that I remember seeing and being with you both in person in Dili in February last year. And we are delighted that you can join us today. So perhaps I can hand over to you for any opening remarks, Dr. Adeti. And I know I have a few questions for you as well, but could you please perhaps outline for us, you know, how the situation is in Timor-Leste at this present time, and we welcome, you know, your presence on the webinar today.
Thank you so much for this important event for us in Timor-Leste. Myself and Nevio will represent Minister of Health in this occasion, very important occasion. Yes, as you know that since pandemic COVID-19 happened in all over the world, including Timor-Leste, we started to have this COVID patient since 21st of March. Then in this year, in last year, we have a successful how to prevent this COVID in Timor-Leste. Unfortunately, till end of 20 December, as our neighbor Indonesia, the number is increasing fast. Then as you know, that Timor-Leste, again, we have a border with Indonesia. Then till December 20 to February 21st, the number was increasing. And then also we have also death cases that happened. Till now we have till 19, 20 cases for today. And then positive case achieved around 80,000. 80,000. 8,000. Recovery around 7,000. I think this is a great achievement from Timor-Leste, but not only us, but also all the support that come from other countries as well, include Australia, give us a big support. Come with a vaccine that we started since April. The deployment plan that we have been established to 20, and then follow one long process, but finally we can implement our vaccine deployment plan since 7 April. We achieved around doses that we received around 294,800. Also, till now, till today, 24, the doses that administered, the people that received this vaccine, around 198,000 for the first dose and then the second dose. Our estimation for Dili only around 210,000 population, but almost 50% of people in Dili capital got the vaccine already. This again a big achievement with the contribution from Australian government, COVAX itself, and then also for Chinese government. Thank you.
Thank you, Dr. Adeti. Nevio, did you want to add?
Yeah, I think thank you for this opportunity, and thank you for all the support that is coming arriving this way from Australia and from all the other counterparts, especially from Australia. I am privileged to be with Dr. Odete and to present on our vaccination campaign for COVID-19. And it's I know that this is, we are not supposed to say, we are not present now because it's the Kiribati time, but I am looking forward to mention a bit or two about our vaccination plan and campaign so far.
Thank you. I think we really appreciate you going earlier in the order, as I think our colleagues from Kiribati are still trying to join. But you know, firstly, I think you know, thank you, Dr. Adeti, for those opening remarks, because it is quite you know, as you mentioned, I think Timor-Leste really did so well with no COVID for quite a long time, and then having both a COVID epidemic and terrible floods, and now with the program, some of the detail that you're sharing with us, I know we're very pleased to see. And Mr. Cemento Nevio, I know you had some slides here. Would you be able to take us through those perhaps just in a little more detail, because I think everyone is very interested in seeing some of the rich data that you have.
All right, thank you very much. If it's a privilege to present on behalf of the government of Timor-Leste, and also sitting beside our DG here. And I would like to go ahead with the cases in Timor-Leste, our COVID-19 epidemiology in Timor-Leste. we were very successful in the beginning until the until February this year, where we had 1 year of delaying the first wave, and the sporadic cases and the first case was detected in the border area in 15th of February this year, and then that has led to major public health measures and public sanitary fence that was set up in our western border, and that eventually has led to come to delay, which was detected early March, and this has led to a community transmission that has been declared in April, and now the cases has gone up and has been spread to other municipalities, although Dili still has a community transmission and other sporadic cases that happen in other municipalities. So at the moment, this is I would like to acknowledge our integrated crisis response team and our epidemiologist from AUSMAT and the team that are coming and help us on plotting this graph to us. And at the moment, Dili we have experienced slight reduction of cumulative case detection, but that doesn't mean that we have to let our guard down, and cases are there to be detected. And I think with the vaccination campaign that we have right now, and we have seen that the positivity rate so far, we have 7.9% as of yesterday, and there are some cases that in municipalities that like in Baucau municipalities or in Ermera municipalities, in Maliana municipalities, we started to see the spike in cases, and this has led to further discussion on whether to go ahead and declare the local transmission. But at the moment, we are still in the discussion periods, and this is we are hoping that this can go for a Ministry of Health decision for further public health measures, and we are grateful that this we have delayed the vaccine, the first wave of vaccine of the attack of the COVID-19 attack in the country for 1 year. Now that we have the assurance of that there is vaccine, and which have been helpful for our public health response, and we have many. At the moment, we have received from COVAX initiatives, COVAX facility from the Australian government, also from the Chinese government, also that has arrived. But as at the moment, what we would like to say is that we are grateful that these are the opportunity for us to drive our vaccination campaign. So we divided the phase 1, our vaccination campaign, the summary of our vaccination rollout so far. We started our phase 1 in 7th of April 2021 with the target of essential frontline workers. That's including healthcare workers in all municipalities. And then after that, our phase 2 started with the people aged over 60 and those with comorbidities. These were targeted in other non-capital in municipalities. And then we went ahead with the phase 3 with those number 1 of phase 3 with everyone aged 18 years old, which based in Dili in late May. And then currently we are running the phase 1 of dose number 2 for essential healthcare workers, essential frontline workers in all municipalities. So far, this is what we have received from the COVAX shipment, which are 24,000 in early April, then 100,000 doses in the first half of June. Then we have 70,000 doses so far over 4 shipments between May and June. And in first half of June, we also received 100,000 doses of Sinovac from the Chinese government. But with the increase in dose, at the moment we have received, or the total of, we estimated to have the required doses for Timor-Leste is about 1,176,308 million doses. We have received 294,800 doses so far of the 333,000 that is projected. So the vaccination campaign has already been gone underway, and we are mobilizing our healthcare workers, our vaccinators to vaccine. The idea is to vaccinate. So they are increasing those deliveries, more than 20,000 doses in a single day across the country. That's our target. The government has set up also the daily target of 10,000 vaccination across the municipalities, across 13 municipalities, which is it's achievable given that the last 3 days we have achieved more than 10,000 doses administered for the last 3 days. So I think that's the number of targets that we can achieve with, and that's why I'm thinking we are looking at the large shipment of vaccine could enable rapid expansion, because we believe that our vaccinators can vaccinate a lot of numbers, reaching that target. So far, the 50% coverage people age 18 years with first dose, and then in Delhi, that's in Delhi, and outside of Delhi, it's 11% coverage of people over the age of 18. And at the moment, we are doing the first dose and also the second dose. So we believe that with the setup that we have, and with the number of vaccines arriving from number of vaccines arrive, we believe that we can achieve that number, and we will reach the targeted number. So having said that, all the vaccination campaign, we also have challenges and also strengths. So I would like to mention the challenges that we have. The main challenge is the uncertainty of the timing and amount of vaccine supply. I know that all the small countries all experience this, but with proper timing and proper management, I think we hope that we can have more vaccine to drive this vaccination campaign. The second would be our logistic issue, which that's something that we can deal internally. We're running with like vaccination card also, because it's delay in shipment of our vaccination card. Sometimes it can it doesn't prevent us injecting, but it's just a small issues in between. And also the third challenges will be the responding to the perception of changes in AstraZeneca advice in Australia. There was a mixed messages coming out from the local news in Timor-Leste, and this is something that gratefully responded by the Australian ambassadors in here, and also the Minister of Health responded through communications, official communications, which has largely appreciated by a local community. So our strength, I would like to mention our strengths, and as of today, all of our national heroes, national leaders already received the vaccination. That's including our father of the nation, our Senana Gusmao. He received his first dose of vaccination today, and this is something that can further drive more vaccinations to come, more people to come for vaccination, and to curb down on the skepticisms. And this is something that this is the will of our founding fathers, and this is a good message for us, for population. And the second would be the flexibility and the agility of the government. That's including the Ministry of Health, which just rapidly adjusting to the shipment, and on a short notice, we are ready to administer vaccines. If we have more vaccines, we can deliver more and we can reach that target. I think this is the message from us, from the vaccination campaign from the Ministry of Health, with the DG Odetes on our side, on my side, and we can drive this forward. And with the Ministry of Health, with support of the Australian government and all hands on deck, and we can achieve the number. Thank you.
Thank you very, very much, Nevio, for that excellent presentation, and also Dr. Odete. I think congratulations to Timor-Leste. I think it is absolutely wonderful to see the accomplishments that you've made, and I would very much like to acknowledge and say how excellent your progress has been, and it's wonderful to be able to hear about that today. Could I ask you, early on, when your first shipment of vaccines was right around the time of the terrible floods in Dili, and I think we were all incredibly impressed to see the news that you were able to start the campaign even with the floods and the outbreak of COVID at that time. How hard was that time, and what did you learn from that time at the very beginning of the vaccination program?
Yes, thank you. I think for the preparation for the campaign, we started on January. We started to have this implementation plan on hand, as we divided into 5 or 6 sub-technique, and then we do the preparation. Each sub-technique, they have prepared their own. So started on February, the advocacy for the front line, we start to advocate all the institutions that related. So come to the March, again, 2 months for the preparation for campaign. I think everything is going well then till this flood happened, but we already set up the preparation. So for us, this flood happened, but our preparation been done, and then everybody that's included in the front line already ready to receive the vaccine itself.
Yeah, I think it's just to relate to that, is that even though the flood happened, we were ready to give. I know that there are some technical issues during the flood, but we were ready.
And I think that shows great resilience, that you have planned and planned and planned, and it is that preparation that obviously did you in great stead. I know, and I have seen a question already in the chat about this, but and perhaps this has not been helped by some of the changes in Australia, but how are you finding the acceptance of COVID-19 vaccine among people in Timor-Leste? Are you seeing any vaccine hesitancy? I think you may be on mute still. Sorry.
Yes, I think one of our achievement is our comprehensive plan that we have been done. All the line ministries that include in our preparation plan, we have around eight line ministries that integrated. So when we go to the advocacy, yes, some institutions they reject to have this vaccine, but when we come to the explanation with our expert, then everyone can also convince to have this vaccine. At the end, at the first, that we found the difficulties, but we also use other
methods of explanation
that not in the medical term, but we find a way how to explain to the people. So through church, and then through leaders, and then local community, and then also institution that have a big responsibility. So everyone, at least we can convince them. Yes.
No, that's wonderful. I think using many different strategies, and you already mentioned the importance of having people who are very senior and respected in the community being vaccinated, and speaking positively about the need to be vaccinated. Look, I think I might give you a little break for a minute, and I might ask and invite now our regional ambassador, Dr. Stephanie Williams, to join us. But please don't go, Dr. Adetti and Nevio. If you can stay with us, that would be wonderful. And I would like to introduce Dr. Stephanie Williams. So Stephanie was appointed as the ambassador for regional health security for Australia in March 2020. As ambassador, she supports the advancement of Australia's interests in the Indo-Pacific by fostering linkages in Australia's world-class public health and medical research experts between those and partners in the region. And I think, she comes to this role as someone who's well known to all of us in Australia as an expert public health physician and epidemiologist who's been with the Australian government, working with the Australian government for a number of years. So Stephanie, Dr. Williams, I should call you, welcome very much to the webinar. And I'd like to invite you to make, a few comments about, particularly DFAT's, work in COVID-19 vaccines in the region.
Thanks, Christine, and thanks for the opportunity to present on the panel today. And can I extend particular greetings to Digi and Nevio and Timor. Terrific to hear your presentation. And to echo really the admiration for the coverage achievements to date, a recognition of the supply challenges which Australia is trying to work hard to be providing more clarity on supply, and to acknowledge the quick action that the government of Timor-Leste has taken in response to the issues of potential hesitancy or issues that affect confidence, with the quick public statements on the issues arising on the AstraZeneca advice that you referred to. And Australia is very pleased to partner with you in health and in COVID response, and on vaccines in particular. I want to talk today and do a couple of things. One is to provide an overall picture of Australia's commitment to vaccine access in the region, talk a little bit about how that has been designed and is being implemented, some early results, and then finally some challenges that seem clear and varied across the region from our perspective. So on the first part, on the overview, since August last year, the Australian government has committed more than $750 million to supporting regional and global vaccine access. And this includes $623 million for the Pacific and Southeast Asia to access and roll out vaccines, including $523 million for a regional vaccine access initiative, and $100 million under the Quad vaccine partnership that was announced in March, focused on last mile delivery in Southeast Asia. This is in addition to a contribution of $130 million to the COVAX facilities advanced market commitment, $50 million of which was announced at the most recent pledging conference on the 2nd of June last year. And since that time, again at the G7, the Prime Minister announced that Australia would share at least 20 million vaccines from Australia's own supply to the region by mid-2022. We have commenced dose sharing to Timor, to Fiji, to PNG from Australia's own AstraZeneca CSL stock. So that's the overview. In part, I'm going to focus on the regional initiative. The $523 million is the envelope, and I know we we always talk in dollar figures because it's the easiest way to frame up an envelope and talk a bit about the pillars of that. So it has three main pillars, the regional initiative. It's working with 18 countries in the Indo-Pacific. And the pillars are doses, to procure and share COVID vaccine doses, to complement COVAX doses, so in addition to provide end-to-end support, the improvement in systems or logistics or staff workforce training that countries needed to upskill or increase quickly, anticipating the large-scale adult immunisation campaigns. And then the third part is in advisory and technical support, for which we've been really pleased to partner with a number of Australian institutions that Christine outlined on the slide earlier. In how we went about that, though, I wanted to stress at the beginning that as this initiative was being designed, and I do want to recall the point in time at the end of October when the initiative was announced, that we've got to remember that that was 2 months, at least 2 months before WHO had issued the first EU welfare vaccine. Of course, we had confidence that we would see effective vaccines come to market, but it was a really big move by Australia for the region to commit to that dose sharing and end-to-end support to complement COVAX. And I think Australia was a first mover there. But quite as soon as that was announced, and actually even a little bit before, we commenced a series of bilateral consultations. I think I remember speaking to Nevio indeed, with Ministry of Health counterparts across the 18 countries to hear their priorities, their gaps and their challenges as we anticipated COVID vaccine rollout. And it was in the spirit of partnership and consultation that the initiative was designed and continues to be rolled out. Because of course, in all of the countries where Australia is working, we have a bilateral presence, a bilateral development program, and in many of those countries had a pre-existing health partnership, particularly in Timor and in the Pacific, and in some parts of Southeast Asia, which in 2020 we had worked in an immediate COVID response prior to vaccine availability. So it was on the foundation of partnership that the initiative was then designed. And we heard two clear messages: supply, doses beyond the 20%. It's terrific that COVAX AMC was enabled to make a global and equitable 20% commitment, but many countries were saying, but we have bigger plans, we want more confidence in supply, we need to cover more people. So Australia's commitment was actually to enable comprehensive coverage in the Pacific and Timor and make a contribution to coverage in terms of doses in Southeast Asia. The scales of the populations are so different, but in the case of the Pacific and Timor and how we've done the maths, it's effectively budgeting for the procurement of vaccines to reach 80% coverage beyond the 20% is how Australia entered into our planning for the initiative. And that is underway through two main vehicles, the dose sharing that I've mentioned directly from AstraZeneca CSL, which over 350,000 has been shared to date, and we expect that to increase. And a recently announced UNICEF Australia partnership under which we expect to procure doses for approximately 15 million people. So it is a range of sources that Australia will deliver on vaccine doses to the region. In how we've been working on the end-to-end support, and Christine acknowledged our partners in the region at the beginning, but we at country level with WHO, with UNICEF, and in some cases other bilateral health program partners, we have injected funding to enable to effectively enable the priorities of the country when it came to preparing for and delivering vaccine campaigns outside of the doses themselves. And some of the early results and examples, big cold chain investment in Vietnam, supporting the government's own investment to buy fridges, practical, essential and useful for the supply chain. In Samoa, again, I'm picking up individual results to give you a sense of the program without trying to communicate the totality, we've been able to fund the Tamanu health information system so that from the beginning of the campaign, Samoa has got an individual and population record of coverage where individuals have their own record, but it's digitised from the beginning, and it has really improved their real-time monitoring of coverage. And then the third pillar, so we've got the doses, the wraparound support, which is underway. And the third pillar was the advice and the partnership pillar, I like to think of it of, which is really recognising that there is already a lot of relationships between Australian institutions and our regional institutions and partner governments, but through a direct funding agreement with NCIRS and the ARIA partners and the TGA, effectively to provide an ongoing source of technical advice and support to countries as they tackle the various and emerging challenges with the First Pass campaign, the future thinking about who do we need to continue to vaccinate, how do I manage mixed dosing schedules, what are some ways we can improve adverse events reporting. Those kind of issues, which are live and varied by country, are the sort of the rationale for having a technical assistance partnership. And Sarah Sheridan in Timor is a living example of the deployment of an Australian expert to work with and alongside, but really to build the connections between institutions and experience in Australia and the region. So that's the $523 million partnership in a nutshell by pillar and approach. And I said I would finish on some of the challenges that lay ahead of us, and I hope some of this can be drawn out through the discussion. And I'm pleased that the panel has put an hour and a half on, because my experience has been that when we do these just for an hour, you get to the really interesting part after people like me stop talking at an hour, and then we have good time for discussion. So I promise to finish up soon. But it looks, there are countries that are clearly have enough appetite in their population, capacity in their system and supply to be making big inroads for what we agree is an urgent public health priority, prevention or protection from COVID, almost independent of the COVID situation by country, just by virtue of the fact that we have a shared global interest in protection and prevention from COVID. And then there are countries where the pace of rollout, the appetite amongst adults is very different and slower. And we have to be thinking about, how is it possible that with Australia in partnership or countries alone, we can think about getting beyond a 20% uptake? And the challenges that we see in some of the countries which is slower or more complex actually is a shared challenge for all of us. But that seems to be clear in the Pacific. We've got some clear leaders in terms of pace, and countries that are struggling to, in a way, convince populations of the urgency, as well as deploy the resources to some of the harder to reach locations. Of course, we can't talk about challenges without acknowledging the supply challenges, and for Australia, clarity around the supply and the sharing of the 20 million doses that the Prime Minister has pledged is a priority and is underway. But we recognise that countries are faced with a multitude of potential, but lack of precise offers and delivery schedules. And we've been working as hard as we possibly can to address that issue, but the supply challenge. And then I think, and I'd be interested in the discussion and views of Christine and colleagues in the panel about what do we do? Just say you're a country that has been able to reach your target population in the main by the end of this year or early next year. How do we start thinking about what's a recurrent COVID immunisation program look like? How much do I need to budget for? What types of vaccines will I need to continue to provide? How am I going to manage that and the requirements for certification of such vaccines? So some of these recognition, we have a campaign and a 2021 emergency response and probably into 2022, but in doing so, recognising what are the issues we need to be thinking about now on supply, demand, and in the medium term, combined with the fact that at some point we will have to integrate, and it's clear for us too, this big focus on the single technology in 2021, a critical one, and one that I'll confess I didn't think it was possible to have a vaccine in 2020 as we did, and I'm pleased to have been wrong. But at some point there's a question about treatments and diagnostics and the other tools just as important to continue to manage COVID, let alone the other infectious disease risks that may be presenting themselves by country or in the region, and the other emerging infectious disease drivers that haven't gone away. So yeah, I think it's this discussion is going to be very interesting, and I'm so pleased that I hope we have our colleagues from Kiribati on the line. I'll go off video and try and keep making that happen, Christine, as I'll stop there. I think I'm on time.
Stephanie, look, thank you very much for that extraordinarily comprehensive overview. And, you know, I think both outlining, you know, the contributions of Australia and the Department of Foreign Affairs and Trade and Government, but you know, also the genuine challenges. And I think that supply is obviously, you know, uncertainty of supply and just restriction of supply has clearly been felt and seen across the globe, you know, experienced by countries in our region, experienced by those who are both delivering and accepting the vaccine, and it's been a genuine challenge. I did, you know, I'm going to mention now, I think that we probably are unlucky to connect with Kiribati at this stage. I've just heard both from your colleagues at DFAT and from our team that it appears that the telecommunication systems are down, and despite what we understand was a very genuine try, there's been no luck in being able to connect. So I think you know, that may allow us to do a little bit shorter than the hour and a half today, but I did want to acknowledge that, you know, I think Dr. Adetti and Nevio raised a really important question around how has, you know, Australian advice around the use of the AstraZeneca vaccine, for example, been challenging. And I do want to talk about that. But before I do that, I wanted to kind of bring into this conversation our you know, important colleague from the Therapeutic Goods Administration. So I'm like to introduce now, and this is really to bring, I think, him onto the panel as well. Oh, there you are. Hello, Michael. So with colleagues from the TGA, I'd like to introduce now Dr. Michael Wiseman, who is an Assistant Secretary at the Australian Regulator Therapeutic Goods Administration. And he particularly heads up the Medicines Regulation Branch, but has also, I think, been very passionate about, together with the Secretary, Professor John Skerritt, the you know, the Regional Assistance Program. So, Michael, I know that you have got a couple of slides to share, and we thought we might just have a few comments from the TGA, and then we thought we might talk about vaccine safety and some of the considerations in Australia compared with how that has you know, impacted Timor-Leste, which we've heard a little bit about already. But over to you, Michael. Thank you so much for joining us.
Good afternoon, everybody. Thank you, Christine. It's lovely to be here and join everybody on this call. I do have some colleagues with me in the room here. So yes, just a couple of quick clarifications. You gave me a promotion as well as an extra title. So I am only a Mr., not a doctor, but I appreciate the sentiment. Yeah, Assistant Secretary of the Scientific Evaluation Branch, but which really doesn't mean anything to most people on the call, and it's not really necessary that you know what that means. But that's my day job really, but my after hours job is to really lead a team of very dedicated individuals and experts here at the TGA that have been pulled together and brought together thanks to funding from our colleagues at the Department of Foreign Affairs and Trade to provide technical assistance and support to countries as COVID-19 vaccine is rolled out across the South Pacific and the Pacific and Southeast Asia. So as the Australian government's national regulatory authority, we have responsibility for all aspects of regulating medicines and medical devices in Australia. And that includes right from the pre-market assessments and approval of new therapies through to post-market monitoring and ongoing follow-up as a result of those adverse events that may or may not happen. And I think it's a real delight to be part of this program and to be partnered with NCIRS and our colleagues at the Centre for Health Security at DFAT. And I think collectively we have a very strong partnership and offering in the skill sets and technical expertise that we can provide support to countries who may seek to tap into that resource. From TGA's point of view, we are a regulator, obviously, and we have brought together many of our medical officers, our regulatory scientists, our other technical experts with expertise and experience in both pre-market and post-market monitoring of products. And I guess those skill sets are on offer and available to support the safe rollout of high-quality COVID-19 vaccines across the region. Being in the aid space is not a traditional role for the Therapeutic Goods Administration. We are largely focused domestically, but through this funding and through these programs, it has added an exciting new element to the work and that we have on offer here at the TGA. And I think what a wonderful opportunity that I'd prefer if it didn't happen, but the COVID-19 pandemic, as a regulatory scientist, has meant that we have an opportunity to really ply our trade in a sense, in a way that's never been, that we've never been asked to do so before. So it is a wonderful opportunity for us. I wish it didn't happen. I wish we weren't in this situation, but unfortunately we are. So what can we do to make the most of it? And that is provide our expertise and our support to the region. So I think just to clarify, if there are countries or other areas who are looking for support in understanding the technical aspects of some of the vaccines that are being offered, or would like support with the regulatory decision making, so helping understand the science that's gone into the vaccine technology, or support with the post-market monitoring and surveillance of vaccines, that is exactly what this expert technical assistance program is designed to do. So with colleagues at NCIRS and here at TGA, the skill set is there, I think, to handle any of the challenges that we may be faced with. I know there's only a couple of minutes, Christine. I think that's given a very brief overview of what we're trying to do, but we have, I think we've got a very good offering here to countries if they would like to, reach out.
Oh, thank you. Thank you very much, Michael. And I'm just going to call you Michael now because having messed up everything else, you just, I've mixed up all the titles and things, but thank you for those comments. I will invite another Michael to come on camera now too, and perhaps Stephanie, I could invite you to come on camera, and Dr. Adeshi and Nevio, if you're able to rejoin us, I hope, from Timor-Leste. I'll just introduce Michael Wong, who is our Head of Global Health here at the National Centre for Immunisation Research and Surveillance, and is going to take over some of the coordination from me as our panel chair. And I think, many of you would know Michael, but his background is working in both the Global Vaccine Alliance and also for WHO. But Michael, over to you.
Thanks, everyone, and thank you for what has been a very rich discussion so far. For all of the audience that are out online, we want to turn your attention. There is a Q&A button at the bottom of this this Zoom meeting. If you have any specific questions, please do click and enter your questions into the question and answer box. Some of the questions we can direct to some of the panel today, and we've also got a team of staff also answering questions as they come in. So we've got about 15 to 20 minutes for questions today. But one of the reoccurring questions has come up has been around the AstraZeneca vaccine. And one of the big ones has been around, why did Australia change advice on the AstraZeneca vaccine? And did that advice take into account the impact that the decision was going to have on many of the countries that we're talking about today? There is a rich discussion in that, and I think we would be keen to get to hear from Timor-Leste, maybe also from Professor Christine McCartney. In your role working with the Australian government, could you maybe kick us off around why did the change happen, and what advice was taken into account when it did?
Oh, thanks very much, Michael. So, look, I have wear those hats, I guess, as part of a member of the Australian Technical Advisory Group on Immunisation, and I'm not speaking on their behalf today, but I think, that group, which is an advisory committee, worked very, very closely with the TGA. Once it had become clear from the international data that there was the potential for this very rare but new clotting condition to be associated with AstraZeneca vaccine, there's been very detailed surveillance for this here in Australia. Now, it's important to emphasise right up front that this is a rare condition, and Australia still has a considerable use of the AstraZeneca vaccine going on right now. We're very much rolling this vaccine out at the current time with a focus on people over the age of 60, and it's been shown to be highly effective in preventing severe disease, in preventing any type of COVID-19, and indeed in also preventing transmission of COVID-19 from person to person, which is really excellent. The situation in Australia was that as we started to see some of these cases of thrombocytopenia syndrome in people, and particularly in younger people. So in fact, our first couple of cases were in 40-year-olds. We had an alternate vaccine that was already actually being supplied. So that was in respect of Pfizer vaccine. And Australia then took the path that I guess a number of other European countries took, which was to say, we have an alternate vaccine, we'll preference that alternate vaccine over the AstraZeneca vaccine in these younger age groups, and then we'll monitor and see how we go. And I think the other thing, of course, is that we, by and large, have not had COVID-19 vaccine. So we were really looking through the benefit risk lens at the time, knowing that we didn't have circulation of COVID, and we could, and have, I think, grow in the program more gradually in that context. Now, we have recently revised that advice. I think when we first issued that advice, we very much tried in that document to emphasise that this is a very country-specific decision, and WHO have said the same thing, because each country is needing to assess the benefits compared with risks. We know that the severity of COVID is so great, and indeed we don't quite know yet what the rate of this condition is in every single country. So I'm very interested to hear from Timor-Leste, because I know that they have been doing very good adverse event surveillance. But I think joining colleagues from the Western Pacific region this morning and the past few days, we've heard from South Korea, who have also been conducting very comprehensive surveillance for thrombocytopenia, and have had an extraordinarily low rate. And it's interesting that they, in general, and I didn't know this until fairly recently, that the rate of clotting conditions overall is actually lower in some Asian countries, including in South Korea. So, what I think this really comes back to is the sort of expertise and assessment and importance of countries to come from their own position of saying, is this right for us now, this vaccine at this time in our population? And as I mentioned, with alternate supply, Australia is now preferencing Pfizer over AstraZeneca in people under the age of 60, but we're very much encouraging those who've started with a first dose of AstraZeneca to complete the second dose. And of course, depending on where you are, we certainly still have AstraZeneca, fully registered and approved from the age of 18 years.
Thanks, Professor Christine. Colleagues in Timor-Leste, there was mentioned that coming from a strong position, one of the questions that's also been raised here in the chat has been how colleagues in countries have been able to overcome the fear of receiving the COVID-19 vaccine. The question here is, it's saying that less than 25% of healthcare workers have chosen to get it in 6 PNG provinces. Sadly, some doctors and nurses are discouraging even the town people to get it. Perhaps directing this question to Dr. Odete and Mr. Nevio-Sarmento, we've heard a very encouraging story from your presentation, and that there's been strong demand for vaccination, not only in Timor-Leste, but also amongst healthcare workers. What are some of the key strategies that you've applied to help overcome fear of receiving the COVID-19 vaccine in Timor-Leste?
Yes, thank you once again. I think, as I mentioned earlier, that we have our deployment plan, that a very comprehensive team that we established. Like we have 6 sub-techniques, and then most for the commission that look after advocacy, and then how to prepare the information related with all type of vaccine itself, and then which vaccine that will implement in Timor-Leste. So far, the government decided AstraZeneca as our vaccine that we choose according to Timor-Leste. We have no yet laboratory in place, so we should have the vaccine that approved by WHO, UL, that we can consider. And the other issue is also based on our logistics method, that AstraZeneca also can stored in our cold chains, that routine immunization that we use to have these cold chains also. And then most to readiness our facility in Timor-Leste. And then when we come to the implementation, the advocacy that we use, we integrate the team again as all stakeholders that play the important role in each institution or in each society, that we involve civil society, and then also church, and then leaders, political leaders that have much influence in our society. So with this kind of strategy, and then we use huge communication like a TV, radio, and then our Facebook, WhatsApp group, every media that we can use, we maximize all the things. Then finally we can achieve, at least right now, we can achieve 20,000 people vaccinated a day. More than 10,000 that government targeted. Yes.
Thanks, Dr. Tete, for some quite impressive news. And 20,000 people a day is an enormous amount of people. There's another question from the audience here, also for Dr. Odete. Is there any evidence that the younger population in Timor-Leste is less vulnerable to COVID-19 than the Australian population? And I think that the bigger question here is, given that there have been a lot of changes in countries around Timor-Leste, does this impact Timor-Leste's vaccine strategy?
It's Christine. I wondered about, and I can see that question's been posed by one of our colleagues from the Northern Territory. I guess it might be around, do young people perceive that they are able to get COVID and get sick from COVID? Do you think that they are taking up the vaccine or will take up the vaccine because they think of COVID as serious for them?
Yes, relate with people that get positive with COVID-19. We have not a lot, but few number of kids that got also COVID positive. Most of the positive case for the younger, 18 years above. But also the people that recovery for this COVID, they also very interested to get vaccinated also. So we also explain that as we all know that who already get this COVID, they develop the immune system itself, but it depends to you all. If you want to vaccine, then you can apply for the vaccine also. Yes, and then we also have few people that now getting vaccinated with COVID positive. And then for the kids that about under 18 years old, a lot of quiet students, primary, secondary school also, they are very interested to get this vaccine. Yes, but now, since you know that the government still on this process, how to get also vaccine for 18 years, below 18 years.
So I could relate to the numbers of children in young population in Timor-Leste. Yes, there are a lot of asymptomatic positives in the country. That's due to the fact that all 50% of our populations are under the years of 18. So that is why we can see that the young population, they feel like okay, they feel fine even we detect the COVID positive, they are positive with COVID-19. But having said that, the message from our leaders were clear when they see our leaders receiving vaccine, and this has pushed more and more people are coming up. Hesitancy is there, don't deny it, but then having leaders showing that they wanted to receive the vaccines, and so almost all of our leaders, I think, from military, from our founding fathers, everybody's receiving the vaccine. I think this is a very good message and showing a very good. It's showing that they are okay with this vaccine, and we can relate to the young population, and that we're having said that, and the numbers are, we can see, as Dr. Odette was mentioning, on the 22nd of this month, 2 days ago, we achieved that 20,000 doses per day, which is a huge number. And thank you.
Thanks, Nevio. I mean, that's a huge number. And again, it's quite impressive to see how Timor-Leste has been working with some of the challenges. I want to come back to one of the issues raised by Ambassador Williams around some of the challenges in the region. And one of them is around regulatory support. For colleagues at the TGA and Mr. Michael Wiseman, we're talking about one of the challenges around working towards a recurrent COVID program and what that looks like. That's very new to everyone within the region, but one of the things that the TGA has been doing over the number of years has been developing strong connections within the region. Can you walk us through some of that work and in terms of strengthening regulatory support in the Indo-Pacific?
Yeah, sure. Yeah, you're right, Michael, that we have been working for a number of years with several countries in our region under a previous aid program called the Regulatory Strengthening Program, which was aimed to assist the national regulators to strengthen their capabilities and capacities, essentially. We work closely under the WHO's framework for assessing a regulator's capacity and capability, and they call it the global benchmarking tool, and that allows the WHO to undertake an assessment and look at the key areas of a regulator's that a regulator is responsible for, and make an assessment of that regulator's capabilities and capacity. We've been working closely with a number of countries to assist them in certain areas, and largely a lot of that is around enhancing particularly practices around reliance on other trusted sources of information, business process improvements, but also supporting the WHO as well in some of the twinning arrangements for assessing new medicines that are coming to market and new products. And we've assisted a number of countries make accelerated or faster decisions, their own regulatory decisions, through our assistance in undertaking some of the assessments of the data that accompanies a medicine application. So I think it was very timely that we already had strong relationships with those countries and their national regulatory authorities. COVID has come along. This new program has been developed. It builds on those relationships that we've already established, but it has also expanded the number of countries that we're working with. So there are a large number of countries that we haven't been working with, and we're rapidly trying to build and establish those relationships with not only regulators where they exist, but ministries of health, but also some of the disease programs who are responsible for rolling out vaccines. So it's a new area for us in many countries, where we're relying strongly on support through our Department of Foreign Affairs and Trade and other partners such as NCIRS to assist with some of those, building some of those relationships. But if there are any people on this call who are interested in some of the things we're talking about today, please get in touch. What's our RSP at health.gov.au. And trust me, there's a lot of people standing by to offer lots of support.
Thank you so much, TJ colleagues. I can also see Dr. Odete Nevio, if your hand up, please, Dr. Odete Nevio.
Yeah, just a question on the practicalities in here regarding the interchangeability between COVAX and Australian AstraZeneca. It's because, you know, coming from a country that we're trying to introduce fast and rapidly, and it would be we know that scientifically they are similar ingredients, similar, but just want to find out whether we can introduce first COVAX, second AstraZeneca from Australia. So it's just a question of technicality.
Thanks, Dr. Odete Nevio. That's a great question, and we're coming close to time, but there's also, related to your question, another very good question in the post, and that's, as you continue what is 200,000 vaccinations a day, when do you foresee that the majority of the population in Timor-Leste will be fully vaccinated? And a good question also, and feel free to refer that to the rest of the group, but do you have access to all the doses you need to achieve complete coverage?
Thank you. This is a very good question for us, and it's a homework for us to work on this, but more vaccine for us, we can push ourselves to reach that number. We are looking at the end of the year target but we can do faster if we have lots, because we have a lot of people in
Demand,
high demands,
High
and we
demand.
have a lot of and also motivations. For example, like we have sanitary fence in Delhi, and younger people wanted to travel out of Delhi. So one of our strategies is to get vaccinated twice, and you go without swab. This is one of the motivation that younger people wanted to get vaccinated. So this is one strategy that the government imposed. So we know that we target the end of the year, but if we have more vaccines, we can do more.
Thank you so much, Nevio. I'll also bat to Ambassador Stephanie Williams. There were a couple of questions in that. Maybe if you'd also like to speak to around interchangeability. We know that the Australian government's doing a lot in terms of working with a number of vaccines. I will make that probably the last question. And after Stephanie Williams, we've got TGA, and then over to Christine. Please, Ambassador Williams.
Thanks, Michael. I'll be very brief because you've got 6 minutes. On the interchangeability, we've got good dialogue with our countries receiving Australia's AstraZeneca through our post in Delhi. We know it's the same ingredients, it's the same vaccine. So for protection, the supply, so long as it's an approved and TGA equivalent approved vaccine. And there are more process issues around access in that very unlikely event of permanent disability or death as a result of vaccination following investigation, that we're balancing access to appropriate compensation available through COVAX and through Australia. Mechanisms exist from both sources. And we are working, and so basically it's a long conversation, and Aditya and Nevio, we can continue it through Carly at post offline. And the second point, I think I just wanted to come back to the certainty of supply for Pacific and Timor-Leste from Australia, in just restating our commitment for buying and sharing the doses beyond the 20% to reach the adult population in Timor. That commitment is very clear, and it's the channel, should it be through the additional UNICEF or mostly the CSL that Australia is making, that is under active and daily consideration, and we are in active and daily conversation with our counterparts at Delhi too. So the commitment is there, it will be delivered upon, and the channels need to be clarified. I just wanted to say those two things. Over.
Thank you, Ambassador Williams. We have time for one quick comment from the TGA, and then we're going to have to wrap things up.
Thanks, Michael. I also just wanted to clarify the interchangeability or the comparability of the vaccine that's produced in the different AstraZeneca facilities. So the CSL Australian product is comparable, and so it is the same as the product that is supplied under the COVAX. So they can be taken very safely together. They are the same, essentially the same product.
Thank you so much, TGA colleagues. I'll hand back to Christine. We're coming close to time. Over to you, Professor Christine McCartney, to close up for the day.
Thank you very much, Michael. And thank you everyone for a very rich discussion. It does actually remind me of one question that I was going to ask, and we won't have time to discuss it today, but I think as countries start to receive shipments of even more vaccines, different types and brands of vaccines, that's also been a question that we're starting to hear come through, is whether you can interchange different brands. And this is an area where there is much less evidence right now. And we, of course, are not routinely recommending that, nor is WHO, but I think it's a very interesting area. And of course, as Stephanie reminded us, we are going to have COVID in the world for a long time to come. And we do need to, probably think about when booster doses will be needed. Dr. Adete, I know you talked about high demand amongst people in Timor-Leste, even who've had COVID already. And we haven't had much time today to talk about the Delta variant and, whether you've been experiencing that. But I think, we do know that with the emergence of variants as well, we may need to have booster doses against those variant strains of the COVID-19 virus down the track. So it is really just the beginning of a discussion around vaccination, I think, that we've had today. But it is, I think, just an incredible example to hear of the many achievements that have been made in Timor-Leste. And I think, I know we're almost at time, but I might hand over to you just to say any final comments, Dr. Adete and Nevio, because I think, we have been very privileged to hear from you today. And I just wanted to give you one last opportunity if you had anything to add or anything special to say before we all sign off this call.
Thank you for the last comment. I think for us as a technical people that work in the ground, I think with this situation, we need more vaccine in place. So if we get more vaccine, that means that our population within this year, we can conclude our first and then second dose. Yes, thank you.
Well, I think that is a wonderful note to end on, and I think it's wonderful to hear when the demand is there and the delivery of achieving 20,000 doses a day in Timor-Leste is occurring. So, on this particular note, I would really like to say thank you, particularly to our audience, for staying with us today. To our regional ambassador, Dr. Stephanie Williams, for giving up a lot of her valuable time today, and for all of the the great work that you have done with the Department of Foreign Affairs and Trade and Australian Government in the initiatives to support COVID vaccine rollout from Australia. Our colleagues at the Therapeutic Goods Administration, Michael Wiseman, and the team here also for setting up the webinar today. And we would shout out to our colleagues from Kiribati for trying to join us today, but not being able to make it due to the technical challenges. And with that, I'll close today's webinar and thank you all again.